Hello and namaskar. Today we are going to talk about the remedy Euphrasia, and as we have already been doing since the last remedy, that is, we talked about aloe from different kinds of books from different Materia Medicas by different authors, and the same way we're going to continue talking about Euphrasia, in which we'll talk about what Dr. Clarke has to say about this remedy, what Dr. Phatak has to say, Dr. Choudhuri or Dr. Kent. So the basic structure will be what Dr. Kent has told about, and we'll add on to a few points that the other authors mention, although all the authors do mention the same points only, but there are a few additions here and there, so we'll do that also. Okay, so let's start. So looking at these eyes, we can see and understand that this remedy has something to do with the eyes, okay, something related to the eyes, and there is burning in the eyes, okay. That is how much we can understand watching this. But how did our ancestors know about this remedy as a good remedy for eye, even when there were no homeopathic provings done? How did they know that this might be a good remedy for eye? So Dr. Clarke writes about this very beautifully at the very start of his Materia Medica, where he says that according to Gravel, the signature of a black spot in the corolla. So this Euphrasia has actually a flower, and in that flower there is the corolla. In that corolla there is a black spot which looks like the pupil of the eye. And this is how this Euphrasia as a remedy was understood to be have some sphere of action on the eyes to the ancients. So this marked Euphrasia as an eye medicine to the ancients, and later on obviously homeopathic provings, homeopathic experiments have fully confirmed its old-time reputation that it is actually useful in eyes. Okay, now the common remedy of this Euphrasia, of this beautiful remedy Euphrasia, is also eye bright. That is, it also involves this eye. So it also denotes that this remedy is very, very helpful in eye related symptoms. This remedy is a short acting remedy, as Dr. N.M. Choudhuri and Dr. Kent says. This has the most prominent feature is obviously the eye symptoms. There are acute catarrhal affections which might be with or without fever. So catarrhal affections meaning whenever there is inflammation of the mucous membranes and there are secretions coming out of it, we call that a kind of catarrhal affection. Now that catarrhal affection can exist in the eyelids, the mucous membrane of the eyelids, or in the conjunctiva, or in the nose mucous membranes. So that can happen. The mucous membranes anyway can be involved and they will be inflamed. Okay, so that is how we understand that this remedy has a great action over the eye. Dr. Kent starts his explanation by first talking about the headache of this remedy, the head-related symptoms of the remedy, in which he says that there is catarrhal headache in these patients. So again, which means that along with the headache, they will have some kind of catarrh, which means some kind of inflammation of maybe nose mucous membranes or eyelids or mucous membranes, which finally leads to watery discharge. So headache with this kind of symptoms with catarrh is called as a catarrhal headache. This is also mentioned as a rubric in Kent's repertory. Now there's stitching pain in the head, so the type of pain is stitching. The sensation is as if bruised, as if it would burst. So as if bruised is something that we just remember in connection to the injury remedies, to arnica, to calendula, or the injury remedies in general. We understand that they do have a feeling of this bruised sensation. Hamamelis and also this remedy, Baptisia, can have it. But this is also present in various other remedies, and one example of it is Euphrasia. So the headache of Euphrasia is such that it is as if bruised, as if it would burst. So the head feels as if it would burst, head pain, bursting, head pain, sore, bruised, evening. So the eye symptoms along with the headache are that they feel that there's this kind of dazzling of eyes from sunlight. So whenever sunlight, what happens normally whenever too much of light enters your eye, you kind of feel uncomfortable, and you want to close your eyes, blink your eyes, or do that all. So that is all what is dazzling of eyes from sun. That happens along with the headache. So there's catarrhal headache, and headache is along with catarrh of any type. Stitching pains are there, and as if bruised, and as if it would burst, dazzling of eyes from sunlight. So that's all about headache. It's not much and it's easy. Moving on to the main sphere of action, that is the eyes, which have been extensively talked about in this remedy. Important point about eyes is its lacrimation. So since there is a catarrhal condition of the eyes that will lead to inflammation, that will lead to secretion. So lacrimation is the secretion of actually tears. So when that is happening, your eyes are watery. So we'll talk about about lacrimation in detail. There are also discharges, since there can be infection in the eye also. So acute conjunctivitis is also something that presents to us. Yeah, and Euphrasia is a good remedy for that. So when that happens, it is obviously infected, and when that happens, there are discharges which are infected. So how will those discharges be? They will be first of all copious. So there will be a lot of discharges, profuse discharges in Euphrasia, okay, and acrid corrosive discharges. So these discharges will cause excoriation. They will be very corrosive and very acrid. Okay, then they will be watery. They might be thin or they might be thick. Yeah, whatever. Okay, now Dr. N.M. Choudhuri says that secretions are mostly mucus in the beginning. So they might be mucus in the beginning but turn purulent later on and are increased. So both these stages can exist in the same remedy. So even if the patient comes to you with a watery discharge, this remedy can help. Even if it comes to you with a mucus discharge, it can help, and purulent later can also help. But the only thing is, all the symptoms should match. The purulent discharges can be thick and yellow. So most of the authors mention it as yellow discharge. So thick yellow discharge can be there when it turns into purulent stage. Okay. So these are the kind of discharges, the characteristics of the discharges of Euphrasia. They are copious, they acrid, they are watery. The secretions are mucus and then turn purulent. They are thick and yellow. Now they have a kind of cutting pain in the eyes which extends to the head. So it also extends to the head. So there is a cutting kind of a pain which extends into the head. The sensation is of pressure in the eyes, as if it was caused by sand. So they feel like there is sand inside of the eyes and it is causing a lot of pressure. That is the exact feeling that they have. In the sensation that they have in their eyes. There's dryness, there's burning. Yeah, that there's a lot of burning in the eyes. Okay, there's burning, there's dryness, there's biting. So biting, cutting, stitching kind of pains is what you see in Euphrasia. Okay, over here they say that there's biting kind of sensation in your eye, in their eyes. Sensation of dust in the eyes, sensation of sand, sensation of dust. These are the kinds of sensations that they have. Itching is violent. Okay, they need rubbing, they need to keep on rubbing, they need to keep on rubbing their eyes, and there's also they need to wink in their eyes. Okay, so the itching is so violent that they need to keep on rubbing and winking. The lacrimation, as Dr. Phatak mentions, is hot. Okay, and all the authors mention it's acrid. So the lacrimation is first of all profuse, as we know, and it is hot and it is acrid. Okay, there is watery. This is what Dr. Phatak says. They have watery eyes as if swimming in tears. So there is so much lacrimation. So we've seen that there is copious or there is profuse lacrimation. So it is so much that the watery eyes are as if swimming in tears. Lacrimation from windy weather. So just if they go out in windy weather or in cold air, they will start shedding tears from the eyes, and they're not crying, but it's happening. It's lacrimation whenever they go into such kind of a weather. There's aggravation in open air, lying or coughing also. So whenever they lie down, they'll have this tears falling off from their eyes. Okay, and whenever they cough, and whenever they are in open air, cold air, windy weather, also that time. Now Dr. Kent in his repertory mentions a few different kinds of symptoms which he hasn't mentioned in his Materia Medica, or also many authors haven't. So eye scrofulous affections, meaning glands are affected, and eye inflammation, meibomian gland. So that's also there. So we already know that the lacrimal duct, and that is also involved because there's a lot of lacrimation. So obviously that has to be involved. There's inflammation in that also. And over here we see that there is meibomian glands also involved. There's scrofulous affections as well. So the glands of the eye are also affected. So as we've already talked about, there's affection of mucous membranes, there's inflammation of mucous membranes in this remedy. So here we see that the mucous membranes in the eye, there are mucous membranes of eyelids, right? So those mucous membranes of eyelids get inflamed, okay? They get reddened, there is smarting kind of sensation, and the blood vessels in the eyelids, the area around that, are also enlarged. So because of all these things, the appearance of the eyeball will be such as if it is completely injected, it is reddened and it is vascular. So you can see those blood vessels prominently on your eye. Okay, eye injected conjunctiva full of dark vessels. This is a rubric mentioned by Kent in his repertory. So eye injected conjunctiva full of dark vessels. Okay, there's agglutination of eyelids in the morning. So in the morning when they wake up, their eyelids are agglutinated. Okay, not easy to open. There's puffiness on the margin of the lids. So the margin of the lids become puffy, become swollen. There's burning, itching, and dryness of the. So this dryness also comes up again and again. We see that there is dryness of the lids. Also, Dr. Kent mentions in his repertory that in the eyes also there is dryness. So dryness is also seen. Burning is also seen. Along with that, this lacrimation. So this water coming out of the eyes, the tears are also seen. So see, both dryness of lids is also mentioned, dryness of eyes is also mentioned, and watery eyes is also mentioned. So there are different stages in every disease, and when every patient comes to you, there are individuals. These are individuals, okay? So they can present to you with different kinds of symptoms, even if the remedy can remain same. So one patient coming to you with dryness of eyes or dryness of lids, and another patient coming to you with watery eyes, and both might get euphrasia if all other symptoms agree. Okay, so that's about the eyes, and this is the appearance of eyes. You can clearly remember the appearance of the eyes if you are able to visualize these diagrams without at any time. So there's blurring of vision also. So vision also gets affected. The vision gets blurred. Dr. Kent mentions vision dim, vision hair as if hung before the sight and must be wiped away. So this is also a very interesting symptom that they have. They feel that as if a hair is hung before their sight, and now he needs to just get that hair away from their eyes because their vision is getting blocked because of that. So vision hairs as if hung before the sight and must be wiped away. And photophobia, which is mentioned by almost all the authors. So they have photophobia. They do not like to be in a lot of light. It affects them. Okay, so these are the symptoms or the indications that the patient will present to you with. Now, what are the clinical conditions that come under the sphere of action of this remedy, or what are the clinical conditions we have already been able to cure with this remedy? So over here, Dr. Kent mentions almost all the pathologies, so many pathologies of the eye, many diseases of the eye, many conditions of the eyes, starting from a condition as simple as conjunctivitis, acute conjunctivitis, to a condition as grave as paralysis of the third cranial nerve, or even ulcers of the cornea, pannus also. So there can be anything ranging from even the slightest disorders to even pathological conditions. So now over here, what they mention is, if there is trauma to the eyes, if there is injury that happens to the eyes, then it might lead to acute conjunctivitis. Okay, this is what Dr. Kent also says. Okay, so acute conjunctivitis can take place because you got some injury to your eyes, or even opacification of cornea. This is what Dr. Phatak says. So Dr. Phatak says that even just because of an injury, your cornea may get opacified, and in those cases, euphrasia can act very well. So we never thought of, or we can think if we read this remedy in detail, but if we just brush it up for our college exams, we never think of this remedy for injuries of eyes. It is not the first remedy that many times comes to the minds of students as the first remedy for injuries of eye, but it has a great action on injuries of eye. Okay, and Dr. Phatak also mentions that acute conjunctivitis or conjunctivitis may occur instead of menses in these patients. Yeah, and it may also occur in measles. So that there is a prodrome stage in measles. So measles is actually, in measles there are a lot of rashes, eruptions that appear. But before the stage of rash or eruptions, there is a prodrome stage. And in that prodrome stage, these patients get a lot of nose-related symptoms, eye-related symptoms. So in that phase, in the prodrome phase of measles, this patient of ours might also get conjunctivitis. And if at that stage only you give euphrasia, then obviously it will help. So we will see how it helps in measles. We have that point in due course. We will see that. But yeah, it also happens instead of menses in these patients, and there's trauma, injury to the eyes, and you have to think of this remedy when it comes to injuries of eyes. Okay. Next, there is iritis from rheumatism. So rheumatic iritis can also be there, since iris is also a muscle, hence it can also be affected in the rheumatism. So there is rheumatism of muscle, that is iritis, that can happen, and it can happen in connection with the rheumatic joints also. So that is how this can happen, iritis from rheumatism or in connection with rheumatic joints. There can also be paralysis of the third cranial nerve, which is the oculomotor nerve. So it is involved in the movement or the functioning of the muscles of the eye. So your eye has those muscles. So these muscles actually help us in the movement of the eye, and these muscles are all controlled by the third cranial nerve, which is the oculomotor nerve. So if the oculomotor nerve gets paralyzed, obviously the movement of the eyes will be restricted, and that happens in this remedy as well. Corneal ulcer, pannus is actually when a tissue grows or gets extended over your eyes, okay, over your cornea. So that can happen. Pustular inflammation, so anytime pus formation can take place. Spasm of lids, so eyelids are a great sphere of action, okay, in the eye. So in the eyes, actually cornea is also also a sphere of action. Iris is a sphere of action. Eyelids are a sphere of action. So almost the whole eye is affected with this remedy, can be affected. So spasm of lids also takes place, and etc, etc. So there can be many different conditions. The only rule is that your symptoms should match, your symptom similarity should be there. The remedy you're giving should be a similimum for the case, okay. So the eye symptoms are these many, and those are the most important symptoms of this remedy. The eye is the main prominent sphere of action for this remedy. So what did we learn? We'll do it in short because it is actually that important. So in the eyes, we saw that there is lacrimation, discharges are copious, they are acrid, corrosive, excoriating discharges. They can be watery, they can be mucus, they can be purulent, right? We also saw that along with that there will be itching, a lot of itching in eyes, which is violent. They need to rub the eyes, and they need to they need to rub the eyes, they need to wink the eyes because of that. There's cutting pain in the eyes which extends into the head. The sensation is as if there is pressure in the eyes because of sand, dryness, burning, biting. Burning is there, sensation of dust in the eyes, and lacrimation is hot, as Dr. Phatak mentions. Along with it, it is acrid. It is acrid. Okay, and this coat is copious, watery eyes as if swimming in tears, and even dry eyes can be there. Lacrimation from windy weather, from cold air, aggravation open air, lying or coughing. Lying especially, so whenever they're lying, they'll have this lacrimation. Eye scrofulous affection, so glands can also be involved. That is what we saw. So anything ranging from basic acute conjunctivitis to corneal ulcer, paralysis of oculomotor nerve, anything can be involved. Okay, moving on to another very peculiar symptom. This remedy has a very peculiar symptom, and which is very unique. So what is it? So in female reproductive system, we see that these patients have painful menses first of all, and the very characteristic thing is that the flow lasts only 1 hour or 1 day. So that is the only duration that the flow is for in Euphrasia. So the menses will last only for 1 hour or for 1 day. Okay, next moving on to another very important sphere of action of this remedy, which is the respiratory system. So talking about the respiratory system, we see that the discharges over here are bland. Okay, unlike the discharges from the eye, which were acrid, which were corrosive, which were excoriating, the discharges of the nose are actually bland. They will not cause any kind of burning or excoriation, plus acrid lacrimation. So along with this kind of lacrimation which burns, which is corrosive, there is nasal discharge which does not burn at all, which is bland. And this situation is completely reverse of Allium cepa. So in Allium cepa, what happens is that nasal discharge is acrid, so it will be all reddened over here because there's burning, there's excoriation of the skin around whenever there are acrid discharges from the nose in Allium cepa, and the eyes will water, but though the lacrimation from the eyes is bland, unlike in Euphrasia. So that's a very important differentiation between both these remedies. Euphrasia, once again we'll see, we have already talked about the acrid lacrimation until now many times. So you already know that this remedy has acrid lacrimation. Now only what you need to understand is that if the lacrimation is acrid, the nasal discharge is bland, and exactly opposite in Allium cepa. So there's copious fluent coryza. So coryza is fluent. So the nasal discharge will be just like come and it will be just flowing. Okay, it will be fluent. It won't be stopping, it won't be intermittently coming on, or maybe it's not like it will come every evening or something like that. Okay, it will be fluent. It will exist for a day or two in that state where there is a lot of runny nose that this patient has, and then it extends into the larynx, and the symptoms obviously will be cough. So larynx will get irritated, will get, or will have this tickling kind of sensation, because of which there will be cough. So for 1 day or two, this patient will have a fluent coryza, have runny nose, after which on the 3rd day he will start having cough because the larynx gets affected. Now this can also happen, and another condition which can happen, another situation which can happen is they can have both together. Yeah, both together, that is fluent coryza is also there, along with that they also have this cough which comes on from the larynx. Okay, now since larynx is involved, we'll also see that there is symptoms related to larynx like hoarseness, and we'll read that in the notes also in the due course. So now over here there are very interesting contrasting modalities that we find in the same remedy. So in this one remedy, that is Euphrasia, we find contrasting modalities for these two conditions, which are very easy to remember since they're contrasting. So let's understand that in coryza we see, which is due to windy weather. So whenever they go into windy weather, they can have coryza. Now we've also seen the same thing when we talked about the lacrimation, that the lacrimation gets aggravated in windy weather. Okay, so the coryza also gets activated in windy weather, but there's no such thing that that has been written actually for cough. It might be, but it's not written. Now in coryza we see that it is aggravated during night. Okay, at night it will be aggravated, but when we talk about cough, it is aggravated during daytime. So this is during night, but this is during daytime, so completely opposite. Okay, coryza we see that it is aggravated when lying down. So when they lie down, their nose will start running. Okay, there's a lot of water that come out of the nose, so aggravated when lying down. But same exactly opposite in cough. Cough is ameliorated by lying down. So whenever they lie down, the cough gets better. Okay, both are aggravated in open air. Okay, that is same. So both are aggravated in open air, but during night coryza aggravates, and during night whenever they're lying down, the coryza gets aggravated, and the cough is exactly opposite. It gets aggravated in daytime and ameliorated by lying down. Now cough appears after disappearance of hemorrhoids, also a symptom that Dr. Phatak and Dr. Clarke also mentions. So there's cough. So once they have hemorrhoids and the hemorrhoids go away or the pain goes away, they'll complain about cough, and why? So that can happen in those patients. Now in cough we see that there's no cough which at night, like bryonia and manganum. Okay, so this is also symptom of cough only. There's no cough at night like bryonia and manganum. So bryonia and manganum can have cough at night, but as we've seen that there's aggravation in daytime, so there's no cough at night. So this was about the respiratory symptoms. We also have a little more about the cough. Okay, let's see. So since larynx is involved, there is irritation or violent tickling in larynx which compels him to cough. And after he coughs, there is pressure beneath the sternum. So that is what is a symptom that happens after cough. So after cough, they'll feel that pressure inside the beneath the sternum. There is hoarseness in the morning. Yeah, obviously hoarseness because larynx is involved. Now the expectoration is very easy and almost without cough. So even if they're not coughing, the expectoration might just like that come out. It is very easy, but still sometimes they vomit while attempting to cough out phlegm. So sometimes it can also happen that they're trying to get the phlegm out, get the expectoration out, but while trying to do so, they vomit. Okay, they vomit, and most of the authors have said that they vomit out breakfast when they're trying to cough out phlegm. The external nose has actually this kind of flat cancer on the right side of the nose. This is what Dr. Phatak mentions. Okay, there is this, and also Dr. Clarke mentions this flat cancer on the right side of the nose, tumor on the right side of the nose. So this is the external nose that we are talking about. Okay, and this patient is a chilly patient. Okay, they do not like cold, and as we've already seen, even open air aggravates them, even cold air, windy weather. So that already tells us or gives us a hint that this patient is chilly, and that is true. This patient is chilly. Okay, so this patient can have a bland coryza and acrid lacrimal discharge. So that's the most important point, and which is opposite of ileum cepa, and larynx is involved. Ileum cepa has also an action on larynx, okay, but it is different in some ways. So, and the very characteristic modalities of cough and coryza should be remembered. Moving on to the fever of this remedy, we see that this fever that these patients have occurs mostly during the day. Again, daytime aggravation. So mostly during the day there is fever. Stages present are chill, heat, and but the chill is predominant one. In heat, we see that these patients present with a red face and cold hands, red face plus cold hands, and heat descends the body, so it starts from above and goes down. Sweat is confined to the front part of the body only. Most of the times it is profuse on the chest, so the front part of the body, and even when we talk about the front of the body, more profuse on the chest. And it happens during sleep at night, and it is offensive. Euphrasia is suitable in various types of fevers. It can be catarrhal fever, influenza, or even measles. So measles is actually something that is very well indicated in but Euphrasia is very well indicated in measles. So in measles we see that when the symptoms, so this is what Dr. Kent mentions, and this fever symptoms are also what Dr. Kent has mentioned, and I have just noted it down. So measles, when the symptoms agree, it will make a violent attack of measles turn into very simple. So when you give Euphrasia, because the symptoms agree, even the violent attack of measles will turn into a very simple form, making the patient feel better, and will bring out the eruption. So the patient first of all starts feeling better just in the prodrome stage, and the eruption that has to come out, the measles eruption, will bring out the eruption. So sometimes it also happens that you have the eruption, but it is coming out very, very slowly, very, very gradually, and it is painful, or it is causing some obviously discomfort to you. But since we've given the remedy, the eruption will come out very easily, okay, and the fever will also be controlled, and it will relieve the cough and coryza and other catarrhal symptoms also. Now Dr. Kent also says that most of the times what happens is, when you have a patient of measles, a case of measles, pulsatilla is mostly has this kind of symptoms that agree most of the times, but sometimes Euphrasia will also have your patient might present to you with a symptom picture like Euphrasia also. Now another noteworthy symptom that also people or authors have given a lot of attention to is frequent yawning while walking in open air. So frequent yawning while walking in open air is what happens in these patients, okay. Next we are going to talk about a case, a very interesting learning is something that we're going to get from that case. Let's see. So here Dr. Clarke says, Dr. Clarke writes in his Materia Medica that Ames of Rockland, Ohio, has recorded the case. Okay, now this case. So what is this case? There is a 79 years old man, or an old man actually, who has lacrimation and sneezing. Okay, so since there is lacrimation and sneezing, and obviously the symptoms would have agreed, doctor gave him Euphrasia. Okay, after giving Euphrasia, that actually relieved him. Okay, now this lacrimation and sneezing went away with Euphrasia, but along with that also the prostatic trouble that this patient had for some years were gone. Okay, and this prostatic trouble, because it was there for some years, what were the symptoms? The symptoms were that he was compelled to rise frequently in the night to urinate. Now the doctor gave Euphrasia for lacrimation and sneezing, and it did help in these complaints also, but it also helped in the prostatic trouble, which the doctor did not even know about. So from that point of time, the doctor for this patient, Ames, gave Euphrasia in other cases of prostatic trouble also, and he got good results for that. So now something that we did not think about is that this remedy also has an action on prostate. So prostate gland, if there is any patient with prostatic trouble, we can give this remedy also, and it might give us good results. That is what Dr. Clarke mentions in his Materia Medica. Now he also says that as an eye lotion, Euphrasia has great value. I have seen corneal opacities removed by its prolonged use. So even corneal opacities have been removed by its prolonged use. And there is a very, very interesting case that has been given by Dr. N.M. Choudhuri in his Materia Medica as well. You should go back and read that case of staphyloma also. It's very interesting how Euphrasia has helped in such a grave pathology, such a great pathology. Okay, so that's all about Euphrasia. Let's just quickly revise. So we talked about this remedy, Euphrasia. First of all, we saw what Dr. Clarke says about this remedy, that the corolla of this remedy looks like a pupil, and hence people knew that this remedy is for eye, right? So it has great prominent action on eye, as we've already seen. And we started talking about the headache of this remedy in the very start. So we saw that the headache was also catarrhal. Since this whole remedy is catarrhal, so the mucous membranes are affected, secretions are there. So along with the headache, there is nose or eye symptoms and watering discharges. That is why it is called as catarrhal headache. The pain was a stitching kind of pain that this patient felt, and it was as if the sensation was as if bruised, and as if it was bursting. The head was bursting. Yeah, and along with the headache, there was dazzling of eyes, which is also actually a very important symptom in this remedy. Dazzling of eyes was also there. So this was all about headache, which was very, sweet and little. And then we talked about the eye-related symptoms, which were, there are a lot of symptoms related to eye, because eye is the main sphere of action. So we see that again, here there is a catarrhal condition. So catarrh is a very central word to this remedy. This catarrhal condition, that is why there is obviously, there is going to be lacrimation, right? And the discharges are going to be, as we've seen, the discharges are going to be copious. They will be profuse. What is the meaning of copious? They will be profuse. There will be a lot of discharges. They will be acrid. They will be excoriating. They will be corrosive. Okay, they will be excoriating discharges. And we've seen that they can be watery, thin or thick. They can also be first of all mucus, and then they can turn purulent, which is actually most of the times yellow and thick discharges, right? Then we saw the kind of pain that they feel in the eye. So the pain is mostly cutting type of pain, right? The sensation that they have is as if there was pressure from sand, as if there was dust in their eyes, and there is this dryness and burning that they feel, and also biting that they feel in their eyes, right? Then itching is something that we talked about. So itching is very violent in this remedy. Itching is violent in this remedy, and hence he needs to keep on rubbing his eyes and also winking his eyes, right? And the lacrimation we saw was hot, as Dr. Phatak mentioned, and it was acrid. It was a lot of actual lacrimation came from windy weather or cold air. It was aggravated in open air, when he was lying down and when he was coughing also. Okay, then we saw that there was this eyelids which were involved. So the mucous membranes of the eyelids was involved, and it led to inflammation, redness, smarting, and hence this kind of a picture came up. The eyes become very red. There are dark blood vessels that you can see in the eyes, congested blood vessels you can see in the eyes. Okay, this kind of smarting sensation, this burning and smarting in the eyes. That is how the appearance of eyeball will be. There's the eyelids get agglutinated in the morning. The eyelids get very puffy, so there's puffiness of margins of the eyelids mostly. Okay, and then there is vision issues also. The vision gets blurred and dim, and you see they feel as if there is a hair which was hung, and they want to wipe it away. So anything from acute conjunctivitis to opacification of cornea, paralysis, anything can be involved. In menses, we saw that they last only for 1 hour or 1 day, right? Then we went on to talk about the respiratory symptoms that this remedy shows, in which the mucous membranes of the nose were involved, and they gave us a bland discharge. But the lacrimation from the eyes was always acrid. So this is a combination that we see in Euphrasia. And completely opposite we see in Allium cepa, where the nose symptoms are nose discharges are acrid and the lacrimation is bland. Then we see that the nose is first of all involved. There is fluent discharge from the nose. Coryza is there. Okay, and after for 2 days this might go on, and after that larynx is affected, because of which there is cough, right? And this larynx feels that there is irritation, there is tickling in the larynx, which gives rise to this cough. And after this cough, we see that there is pressure beneath the sternum. And we see a very characteristic differentiation between the modalities of coryza and cough. So coryza and there is a cough that we have. So we see in coryza there is aggravation at night, but in cough there is aggravation during daytime. We see that in coryza there is aggravation from lying down, but in cough we see that there is aggravation from lying down. Okay, and both of them are aggravated in open air. Okay, and cough appears after disturbance of hemorrhoids or piles, and there is no cough at night like bryonia and manganum. Then we've also seen that the expectoration is very easy, and sometimes it might happen that they are trying to cough out the phlegm but vomiting happens. On the external nose you see that on the right side of the nose there can be a tumor of flat cancer that these patients get present with, and this patient is a chilly patient. And we see that then we talked about actually fever. So in fever we saw that there are 3 stages: the chill stage, which is very prominent, there is a heat stage, and there is a sweat stage. And in heat stage we saw that there is red face plus cold hands. Okay, and the heat was descending. Okay, the heat descends. In the sweat stage we saw that sweat was mostly on the front part of the body, and we also saw that especially on the chest, and during sleep at night also it was there, and it was offensive. Then we saw that measles are there and pulsatilla like symptom come out. And another noteworthy symptoms we saw that there's frequent yawning, and that too when they're walking in open air. Walking in open air. Okay, then we talked about a case by Clarke in which we saw that this remedy is also used for prostatic troubles, and it can also be used as an eye lotion. So this was all about this remedy, and this was what Dr. Phatak, Dr. Kent, Dr. N.M. Choudhuri, Dr. Clarke have talked about this remedy. We've covered almost a lot of it, and all the most important points we have already covered. So we've covered the whole N.M. Choudhuri, the whole Kent, and the Phatak we've not covered in its entirety, but we have taken the important points that have been mentioned by other authors as well. Okay, so that's about it for today. Let's meet when we will be discussing some other remedy.